Hey everyone, and welcome. Today we're going to peek into a place you probably see every single day, your medicine cabinet. Because believe it or not, there's an incredible story hidden in there. A story about science, nature, and some serious human ingenuity.
I mean, have you ever just held a tiny pill in your hand and really thought about it? What is this thing actually doing inside my body? And where on earth did it come from? It seems like a simple question, right? But the answer? Well, it's anything but. Let's dive in and uncover that story together.
So first things first, what do medications actually do? It's so easy to just label them all as cures, but honestly, their real jobs are way more diverse and, frankly, a lot cooler than you might think.
Okay, you can basically split their main jobs into two big camps. On one side, you have the cures. This is the stuff we love, like an antibiotic that just completely wipes out a nasty bacterial infection. Problem solved. But what about chronic conditions like diabetes, where there isn't a simple cure? That's where the second camp comes in, control. Drugs like insulin don't get rid of the disease, but they let you manage it, day in and day out. One gets rid of the problem, the other makes life with the problem possible. Both are absolutely life-changing.
And beyond just fighting diseases, a huge part of medicine is just improving daily life. Think about it. A simple pain reliever makes a throbbing headache just vanish. Antidepressants can help stabilize someone's mood so they can feel more like themselves. And some drugs can even enhance our functions, like helping someone with ADHD focus their thoughts. It's not always about a dramatic life or death battle. Sometimes it's just about making today a little bit better than yesterday.
Then you've got the behind-the-scenes jobs, the roles we almost never think about. Some meds are all about prevention. A vaccine, for instance, stops a disease dead in its tracks before it can even get started. Some are for diagnosis. You know those contrast agents they use for an MRI? That's a drug that helps doctors literally see what's going on inside you. And others are just there for support, like hormone replacement therapy, which helps restore a function your body's having trouble with. These are the unsung heroes of the medicine world.
Okay, so here's a fun fact you might not know. Every single drug out there basically has 3 different secret identities, 3 different names. And at first, that sounds super confusing, but it actually makes perfect sense once you break it down. It tells you exactly what the medicine is, who made it, and what it does.
So it all starts with the chemical name. This thing is a mouthful. It's the drug's scientific blueprint, its exact molecular recipe. Think acetylsalicylic acid. It's perfect if you're a chemist, but can you imagine your doctor trying to scribble that down on a prescription pad? No way.
And that's exactly why we have the generic name. This is the drug's official universal name. It's recognized all over the world. So that crazy long chemical name, acetylsalicylic acid, becomes something we all know. Aspirin. Simple, right? This name refers to the active ingredient itself, no matter who's making it, which is why generic drugs can be so much more affordable.
And finally, we get to the brand name. This is the catchy, marketable name that a specific company gives to its product. Think of it like a nickname. So the generic drug aspirin might be sold as Disprin. It's designed to stick in your head. But just remember, you can have tons of different brand names for the exact same generic medicine.
So let's just put it all together with a couple of super common examples. You've got the chemical blueprint acetylsalicylic acid, which gets the generic name aspirin, and that's sold under brand names like Disprin. Same story for the active ingredient in Tylenol. The bonkers chemical name N-acetyl-P-aminophenol gets the much simpler generic name paracetamol, which is then sold under tons of brands like Tylenol or Crocin. See? 3 names, 1 drug.
Okay, so we know what they do and we know what they're called, but where do drugs actually come from? Well, this part of the story is a journey that starts out in the wild and ends up in some of the most advanced labs on the planet.
For thousands of years, our pharmacy was, the world around us. Plants, animals, minerals. But wow, has there been a shift. If you look at the medicines we use today, the huge majority of them are synthetic. They're created from scratch in a lab. But those natural sources, they're still a really, really important part of the story.
And what a pharmacy nature was. I mean, plants gave us incredibly powerful painkillers like morphine. Animals gave us the first sources for lifesavers like insulin. A humble little bit of mold gave us penicillin, and that changed the entire world. Even simple minerals, like ferrous sulfate for an iron deficiency, have a huge role to play. These are the natural building blocks of modern medicine.
But of course, we didn't just stop with what we could find. The next giant leap forward was figuring out how to take what nature gave us and, well, make it even better.
This is where semi-synthetic drugs come in. It's the best of both worlds. Scientists take a natural substance, bring it into the lab, and chemically tweak it. The goal?
to make it stronger, safer, or just to fine-tune exactly how it works in our bodies. It's a true partnership between nature and chemistry.
But the evolution didn't stop there. The final step was to move beyond just tweaking nature and start creating medicines completely from the ground up.
And that brings us right back to the king of the hill today, synthetic drugs. These are designed and built molecule by molecule in a lab. Remember aspirin and paracetamol? Total masterpieces of synthetic chemistry. This is where most of the new breakthroughs happen now, allowing scientists to create brand new tools to fight diseases.
And now we're stepping into a whole new world, genetic engineering. It sounds like science fiction, but we can literally program tiny microorganisms to become little drug factories churning out incredibly complex medicines, like pure human insulin or the hepatitis B vaccine. It's absolutely revolutionary.
So, with all this amazing history and science behind us, you gotta wonder, what's next? What does the future of that medicine cabinet even look like?
Well, the future looks incredibly personal. I mean, sure, there's always a pipeline of new drugs being developed, but the real game changer, the next frontier, is personalized medicine. Just imagine a treatment designed not just for your illness, but for you, for your unique genetic code, to maximize the good stuff and get rid of the side effects. That's not a sci-fi dream. That's the future we're actively building right now.
So, from curing an infection to just making it through the day, from having 3 secret names to its incredible journey from a plant to a high-tech lab, the story packed inside that little pill is just massive. So the next time you open that cabinet door, maybe you won't just see a bottle. Maybe you'll see a story of science, of discovery,